Now let's talk about the congenital tumors of external nose. In this, we will talk about the congenital tumors of external nose, including the dermoid cyst and dermoid with sinus. And then we will also talk about encephalocele or meningoencephalocele and the glioma. So let's start with the tumors. We have congenital tumors of the external nose. We have dermoid cyst, encephalocele, meningoencephalocele, glioma. So these are the congenital tumors of the external nose. Then benign tumors of the external nose, we have rhinophyma, hemangioma, pigmented nevus, seborrheic keratosis, neurofibroma. These are all the benign tumors of the external nose. Sweat gland tumor. Then the malignant tumors of the external nose, we have basal cell cancer, squamous cell cancer, and then melanoma. So these are all the tumors of the external nose. We have congenital present at birth, we have benign, and then we have malignant tumors. Benign tumors are more localized, less devastating, less spreading, and they are more easy to treat, localized. And then we have some metastatic or malignant tumors of the external nose also. So let's start with the congenital tumors of the external nose, the dermoid cyst. If you see in this picture, the child is born with the tumor, dermoid cyst, and it's a congenital tumor of the external nose. Occur as a midline swelling under the skin but in front of the nasal bone. So here in the midline it occurs as a swelling and it lies under the skin. No external opening. In this case, this dermoid cyst have no external opening, no sinus present. Now the dermoid with the sinus, this is the dermoid with the pit or opening, pit or a sinus in midline of the dorsum of the nose. Here, there we can see the pit or sinus in the dermoid here. Infants and children usually are affected. Sinus tract may lead to dermoid cyst lying under the nasal bone in front of upper part of the nasal septum. So this is the tract that leads from the top to the dermoid cyst that lies underneath. So this is the dermoid with a sinus or a tract or a pit. Intracranial dural connection, this cyst or the dermoid cyst with the sinus or tract, it has connection in the dural connection in the intracranial region, and the dura connection is we have the three meninges. We have the pia mater, arachnoid mater, and the dura mater. So this connection goes all the way in the intracranial dural area. Treatment is splitting of the nasal bones to remove any extension in the upper part of the nasal septum, and neurosurgical otolaryngologic approach. So the treatment is the removal of any extension that occur in the upper part of the nasal septum. Then encephalocele or meningoencephalocele, as the name shows, cele or celi is the herniation or protrusion of one structure into the another. So hernia is protrusion of the structure into another part, and this is in this part encephalocele or meningoencephalocele. There is herniation or protrusion of the brain tissue and the brain tissue along with the meninges. So herniation of brain tissue along with meninges through a congenital bony defect. So if the bony defect is present, or if there is a defect then which the bone is not properly closed and there is opening in the bone, then there is protrusion of the brain and the meninges through that opening of the bone and cause meningocele or encephalommeningocele and encephalocele. So there is protrusion of the brain tissue and the brain tissue along with the meninges through a defect in the bone. Subcutaneous pulsatile swelling in the midline at the root of the nose, nasofrontal variety, side of the nose in nasoethmoid variety, and also anteromedial aspect of the orbit. So all these are the different how they present. Encephalocele and encephalommeningocele, usually there is pulsatile swelling. It has pulsation in the swelling. If you see in this picture, this is the encephalocele and meningoencephalocele. It has pulsation, especially depending on if it is middle line at the root of the nose. Usually it's nasofrontal variety. If it's present on the side of the nose, is nasoethmoid variety, and towards the eye is nasoorbital variety. Next, the glioma. Glioma is another congenital tumor of the external nose. If you see, this is a nipped off portion of encephalocele during embryonic development. Here, if there is encephalocele or herniation of the brain tissue, a small portion during embryonic development is nipped off from the encephalocele and form glioma. And this is the big swelling known as the glioma. Extranasal or intranasal, it can present as firm subcutaneous swelling on the bridge, side of the nose, or near the inner canthus. Here, this is the inner canthus of the ear, so this is close to the inner canthus, can be on the side of the nose or on the nasal bridge. So all these are the sites of glioma. Glioma is a nipped off portion of encephalocele during the embryonic development, and it's a congenital tumor of the external nose. So that was all about this section in which we talked about some congenital tumors of the external nose. Thank you for watching sqadia.com.